Most experts agree that COVID-19 spreads through droplets when people come in contact with each other. Those droplets fall to the ground quite quickly. That's why staying 2 meters apart protects people against infection, but sometimes even smaller droplets become aerosolized or airborne and travel further. Researchers in China say they detected traces of coronavirus in bathrooms in high-traffic areas in Wuhan hospitals that got there through the air. Although we have not established the infectivity of the virus detected in these hospital areas, their paper says, we propose that SARS-CoV-2 may have the potential to be transmitted via aerosols. But what they detected were simply pieces of the virus's genetic material, and with no evidence they were still infectious, experts say the findings don't reveal anything new about transmission.
Does it mean that COVID-19 is spreading from person to person through aerosols? And I would say definitively not. It doesn't mean that.
The idea of airborne spread is scary because it would mean someone could catch an illness after an infected person left a room. Highly unlikely with COVID-19, says Dr. Alison McGeer.
If this were usually or most commonly transmitted by the airborne route, then we would know it by now.
That's because viruses that are truly airborne are extremely contagious. A prime example, measles.
If we had an outbreak of measles and we sent non-immune healthcare workers into those rooms wearing a mask, if they spent an hour in the room, they would all get infected.
That hasn't happened with the thousands of healthcare workers around the world treating patients with COVID-19. So instead of worrying about getting the virus through the air, experts say, we can protect ourselves by continuing to follow public health rules, such as physical distancing and hand washing. Nicole Ireland, CBC News, Toronto.